So it is Sunday, and I have been silent about the coronavirus for 10 days. It was 10 days ago that I made my first changes. Okay, that was Thursday, right after Lent. Those changes were an immediate closing of my office to office staffers and students. Not a huge dislocation because this is my office. I and my CFO down the hall are the only ones who've been here. But we've been able to broadcast every class, every practice test, every review has taken place on schedule. We have increased the number of learning opportunities that kids can take advantage of. At the same time, we decided, we as staffers, were going to really limit our interactions with other people. That was a few days before you heard that on a widespread basis. That I, for example, would not go to synagogue, even though that was, 2 to 3 days a week. That was a norm for me. Others would stay away from convocation so that when we do come back, we would be less plagued. So let's talk macro. What would Stewart do if governor of a state? Will I apply libertarian principles even in a crisis? And those principles dictate doing very little as a government. Urging people, not forcing, urging people to take the steps that better informers tell them to. The government will never be the best informer. It gets information secondhand in all but a few things, okay? I'm not convinced that the Centers for Disease Control is as up on things as some specialty labs that you might want to follow. Maybe WHO, CDC get clout, but higher clout is people who have been through, on the paramedic level, good practices for swine flu or Ebola when it broke out. Those people's procedures might be worth following best. And as a government, you don't make an all statewide prescription. You let it be in the hands of individuals and small governments, towns, or even enclaves of towns. Let them decide what is appropriate. Is it a quarantine? Is it a shutdown? Is it testing before you do certain things? Let the small towns decide. Give people 48 hours to maybe get out if you don't want to live with our decision. And then it's our way. It's not coming from the feds. It's not coming from a state government. I very much fear a shutdown of the economy that might save a few lives, but might, because the economy is now so ravaged, keep us from saving many more lives, keep production of medicines, keep service providers away that in the future could have helped. If our economy is really, really down, the great things that America has made to save lives and enhance lives, they go away. In perspective, as of today, Sunday, number of deaths in China, which has more malnourished people than we do. That's why they're eating bats and snakes in the first place. They don't have the money to buy good food. So even there are a little over 3,000 deaths in 4 months. Now, that doesn't command a worldwide dramatic change of our habits, especially when habits of younger, healthier people allow us to build up immunities, take vitamin C a little bit more often. I started buying zinc, and I expect to get sick. I don't expect to die. The number of deaths of healthy people that then get afflicted by COVID-19 has been very low. I will give you the prediction. Despite others where there's 1.2 million to as many as 5 million United States deaths, I believe it'll be under 3,000. And to put that in perspective, 3,000 people about were wiped out in one day on 9/11. 3,000 people lose their lives every month to motor vehicle deaths, and close to 3,000 lose their lives each month to homicide. That includes suicide. So we have those tragedies. We live with the homicides. We live with the motor vehicle deaths. Yes, this is a sudden new thing, but it is not anywhere near at the tragic, tragic, tragic rate that we're used to. And even for crises, let's put it in comparison. 1918, the number of deaths, 650,000, is the equivalent of what, again, I and others expect will be under 3,000 over 2 years. Okay, that is 180 times higher. We dealt with it. We can do this again. Don't take rash steps that ruin the economy. I'll conclude by citing one governing official who has taken this to heart. He is the president of Belarus. Belarus actually had soccer matches that began yesterday. Belarus is encouraging old people to quarantine themselves and otherwise go about your economics the way you always have. Britain did that for a while, and then they changed over on March, I think, 17th. So Belarus is the experiment. I think it's a good one, and you should invest in Belarus. You should also invest at least in the mindset of not expecting the government to do that much more for you when you could be doing a lot more for yourself and listening to trusted private places to take care of yourself well. When I made decisions about my life, not a single one was influenced by a government authority. Good people around me sending me what I think is good information is what impelled the change that I did almost on the spot, not the government. Stay out. We'll get through this. I'm Mark Stewart.